Thank you guys for tuning in today's episode with Dr. Hassan. I'm Dr. Hassan, board certified trauma anesthesiologist. Before we get started, if you can like and share, I'd truly appreciate it. This episode is very important. Why? We're going to be talking about how to choose your surgeon, specifically for IUD placement. As an anesthesiologist, I've had the privilege or honor to work with a lot of different physicians, specifically in the realm of procedures, but also interacting with physicians in general. Along with that, I've also lived and worked in all parts of the country, the East, the Midwest, and the West Coast. Because of that, I have some unique insights on kind of understanding how you as a patient should go ahead and probably choose your physician. Now, of course, none of my stuff is paywalled. I'm not going to ask you to subscribe to anything. I'm not nuts like that. But I will ask you, if you can, please like and share because I'm trying to grow this channel. Let's get into it. Last week, I came across this video from Dr. Kazarian where she talks about IUD placements. It's a fantastic video. Let's watch it, and then I'm going to react on the back end, and I'm also going to give you a couple tips on what you should do and what you should look out for when choosing your surgeon. Let's watch the video.
It's Dr. Kazarian.
Mirena IUD.
I did 5 Mirena IUDs today. All the women got lidocaine on the cervix, lidocaine on the speculum, injected lidocaine into the cervix called a paracervical block. They were all on ibuprofen. There was music playing in the room. They had hot pads on their stomachs. The medical assistant was making conversation with the patients to help distract. We kept it peaceful. The highest pain rating I got today
Now this is
was
important.
a 3 out of 10.
Pay attention to this.
It doesn't have to be a traumatizing experience. If your doctor doesn't want to treat you as a human being, give you pain control, is rather treating you as a transaction, then fine. Go give your business somewhere else. If you show up to your appointment that day, they don't offer you pain control, feel empowered to leave and go to another doctor who will. There are doctors out there who really care about this. That's all I wanted to say. Thanks, bye.
So that is a fantastic video for a multitude of reasons, not only being that she understands her demographic, but also because she's proactively talking about an issue that is very often brushed under the rug when it comes to women's pain control, especially when it comes to IUD placement. Now, in this video, she talks specifically about the things that she does in her practice, which help alleviate a lot of the discomfort that comes along with placing an IUD, in this case, a Mirena, inside your uterus. A paracervical block, which includes local anesthetic, yes, numbing medication on your cervix, inside your cervix. This is a fantastic option that is not offered by all OBGYNs. Why is that? It's because back in the day when a lot of the older OBGYNs were training, this wasn't an option. This is something that was viewed as a waste of time in the past because women's pain wasn't really categorized or even appreciated back then, and the idea of having an IUD placed was kind of taboo, if that makes any sense. Nowadays, with the advent of social media, there has been a lot more people, a lot more patients challenging this narrative, which is that women's pain, especially when it comes to sexual health, is very much a painful procedure. Now, I'm very glad that Dr. Kazarian put this out because it takes a lot of, let's say, guts to go ahead and call out a lot of your partners who don't do this. My videos and a lot of other anesthesiologists and surgeon videos that come across your feed on social media show a video of a female getting an IUD placed who feels extreme pain. There's usually some clicking, which has to do with the speculum dilating. And most of the time, the practitioners say, hey, take a deep breath. It's going to be okay. And Dr. Kazarian specifically calls them out and says, hey, you're going to vote with your wallet. This is very important as well. When it comes to procedures, especially procedures in the office, you have an option. You can choose to go to whoever you think is the best fit for you. And I know obviously there's limiting factors like insurance and those kind of things, but if you have the option, try to go for a younger practitioner who probably understands the dynamics of the pain response that comes when placing an IUD. Now, this is important for any procedure that you're having done. Now, obviously, if you're having an emergency surgery or you're having a cancer surgery, and you don't really have the time to go out and kind of pick and choose your surgeons. You don't really have the time to do that. But in this case specifically, having an IUD place, you can kind of, what they say, shop around. And if I was your friend and if I was your doctor, I would highly advise you to shop around. How do you shop around for a physician? One, you go by word of mouth. You try to find other patients, other friends who have gone to the physician that you want to go to and find out what their experiences were. Two, you can always default to the online reviews, but sometimes those can be manipulated. And three, you can always ask questions. What kind of pain relief do you have? What kind of non-opiate pain relief do you have? And in this case, a paracervical block, the ibuprofen, the stomach pad, somebody holding your hand, the music playing. These are all incremental additive features that help decrease the pain and the anxiety of having an IUD placed. I'm an anesthesiologist by trade and training. My entire purpose in the hospital is to get you through the worst day of your life without pain afterwards, or at least as minimal pain as can be. So I 100% approve this message. Now, before we go, I want to give you a couple tips on how you should go about choosing your surgeon and choosing your proceduralist. Number one, you want to have somebody who's mid-career. What do I mean by that? You obviously don't want somebody who's fresh out of training. This is their first 5, 10, 15 surgeries. You don't want to be the guinea pig, but you also don't want the surgeon who's 75, barely hanging on, doing as many cases as they can. And even though they have a great reputation from the past, their recent results typically do not, from my experience, live up to the history. Think about Michael Jordan on the Wizards or Aaron Rodgers on the Jets. They might have a great historic career, but toward the end, Father Time is undefeated. Number two, you want to pick a surgeon who sees you before surgery. As dumb as that sounds, as an anesthesiologist, I see it all the time where a lot of patients meet their surgeon the day of surgery. Surgeons are very busy, I get it, but a surgeon who checks in on you before surgery and after surgery is a surgeon that cares. And when you're in the operating room and something goes wrong, you want a surgeon that cares, not a surgeon that's just looking for revenue or making money. You want a surgeon that actually cares. Because of that, I would highly advise to try to find a surgeon who's going to see you before and after surgery. And if you can find that in the reviews or from people say or other patients say, that's probably the best way to do it. Number three, you want a physician that is up to date. Like the video we saw from Dr. Kazarian, you want a physician who reads studies. You want a physician who does some of the latest procedures. You also want a physician who is up to date on social media. Why? Because a lot of the issues that are emerging in medicine happen first on social media, and then they make their way to the doctors. The physicians that kind of understand that, hey, women's health is important, especially women's pain during IUD placement. Those are physicians that are up to date and are attuned to the feeling of the masses out there. This is important because those type of physicians are the ones that I have seen in my experience are fast, usually very competent, and usually always care. Those are the tips that I have when it comes to picking a surgeon. What tips do you have? Leave a comment below, and also please leave a comment below if you have had an IUD placed and what your experience was so others can learn from it. I love you guys. I'll see you on the next one. And like I said, please like and share. We'll see you on the next one.